NAC N-acetyl Overview information. N-acetyl cysteine comes from the amino acid L-cysteine. Amino acids are the building blocks of proteins. N-acetyl cysteine has many uses as medicine. N-acetyl cysteine is most commonly used by mouth for cough and other lung conditions. It is also used for flu, dry eye, and many other conditions, but there is no good scientific evidence to support many of these uses. Healthcare providers give N-acetyl cysteine for conditions such as acetaminophen Panadol, Tylenol overdose. It is also given to reduce nitrate tolerance. How does it work? N-acetyl cysteine treats acetaminophen Panadol, Tylenol poisoning by binding the poisonous forms of acetaminophen that are formed in the liver. It is also an antioxidant, so it may play a role in preventing cancer. Uses and effectiveness. Acetaminophen Panadol, Tylenol poisoning. N-acetyl cysteine is effective in reducing the death rate and preventing the permanent harm caused by acetaminophen poisoning. For this use, N-acetyl cysteine given by mouth is as effective as N-acetyl cysteine given intravenously. Complete or partial lung collapse atelectasis. N-acetyl cysteine helps treat collapsed lungs caused by mucus blockage. Lung tests. N-acetyl cysteine is helpful when used to prepare people for diagnostic lung tests. Care of people with a tube placed in their windpipe. Tracheostomy care. N-acetyl cysteine helps prevent crusting in people with a tube in their windpipe. Side effects and safety when taken by mouth. N-acetyl cysteine is likely safe for most adults. It can cause nausea, vomiting, and diarrhea or constipation. Rarely, it can cause rashes, fever, headache, drowsiness, low blood pressure, and liver problems. N-acetyl cysteine has an unpleasant odor that may make it hard to take. N-acetyl cysteine is likely safe for most adults when given as a prescription medication. Rarely, it can cause rashes, fever, headache, drowsiness, low blood pressure, and liver problems. Special precautions and warnings. Pregnancy or breastfeeding. N-acetyl cysteine is possibly safe when taken by mouth, delivered through a hole in the windpipe, or inhaled by women who are pregnant. N-acetyl cysteine crosses the placenta, but there is no evidence that it harms the unborn child or mother. But N-acetyl cysteine should only be used in pregnant women when medically needed. There is not enough reliable information about the safety of taking N-acetyl cysteine if you are breastfeeding. Stay on the safe side and avoid use. Allergy. Don't use N-acetyl cysteine if you are allergic to acetylcysteine. Asthma. There is a concern that N-acetyl cysteine might cause bronchospasm in people with asthma if inhaled or taken by mouth or through a tube in the windpipe. If you take N-acetyl cysteine and have asthma, you should be monitored by your healthcare provider. Bleeding disorder. N-acetyl cysteine might slow blood clotting. There is concern that N-acetyl cysteine might increase the risk of bruising and bleeding in people with bleeding disorders. Surgery. N-acetyl cysteine might slow blood clotting. This might increase the risk of bleeding during and after surgery. Stop taking N-acetyl cysteine at least 2 weeks before a scheduled surgery. Interaction. Do not take this combination. Nitroglycerin interacts with N-acetyl cysteine. NAC nitroglycerin can dilate blood vessels and increase blood flow. Taking N-acetyl cysteine seems to increase the effects of nitroglycerin. This could cause increased chance of side effects including headache, dizziness, and lightheadedness. Be cautious with this combination. Activated charcoal interacts with N-acetyl cysteine, NAC. Activated charcoal is sometimes used to prevent poisoning in people who take too much acetaminophen and other medications. Activated charcoal can bind up these medications in the stomach and prevent them from being absorbed by the body. Taking N-acetyl cysteine at the same time as activated charcoal might decrease how well it works for preventing poisoning. Click subscribe to Users Productions YouTube channel.